In this presentation, I will discuss with you guys the pulpal diseases and conditions and the most common and important one, which is the pulpitis. As I have mentioned in the video about the etiology of the pulpal diseases, I have said that the etiology of all of the pulpal diseases are four factors, which are either the biological factors or the physical factors or chemical factors or a combination of these factors like the tooth fractures or tooth displacements. And I have said that the biological factors might be the viruses, but this is not proven yet, might be fungi, and this is also not has been proven yet, and might be the bacteria. And this is the most common thing that we know until this moment, that bacteria are the direct factor that lead to pulpitis or the most common periodontal disease. And till now, pulpitis is the most one, as I have mentioned previously, but there are other diseases, believe me. We cannot say that the only disease that affects the pulp tissue is pulpitis. No, if let's assume that the fungi will go in and infect the pulpal tissues and rot it, believe me, there might be a disease like a pulp rot. Let's call it a pulp rot. So that pulp rot or a pulp mold or anything, but there must be a disease other than pulpitis. But until this moment, we don't know it, and the only thing, because I think that is confused until this moment, because any pain for the patient, we treat it either by pulpotomy or pulpectomy, or as we call it, endo procedures, or extraction. We do not diagnose it, we do not dissect the tooth, because it is something embedded, and that is the problem. So that the known pulpal conditions until this moment are four conditions: the normal pulp and the diseased pulp with reversible disease or pulpitis and irreversible disease or pulpitis, and the dead pulp or the pulpal necrosis. Okay, now we will talk about the normal so that we will be able to distinguish the abnormal. The normal pulp anatomically looks like this. This is an extirpated pulp by a barbed approach, and as we can see it here anatomically is a connective tissue, a white connective tissue, and some blood around it. Of course, it has nervous tissues inside it. Also, it is not only a connective tissue, but it has nervous tissues also. This normal pulp is characterized by the mild or moderate pain to the stimuli that are applied to it, without no spontaneous pain and without no continuous pain. Okay? For example, when you bite an ice cube or you drink a hot coffee, and after that you feel some mild to moderate pain that subsides after the removal of that stimulus. That is normal. That is very normal. You don't have any problem with your teeth, because, guys, as we have said before, teeth and the pulp inside them are tissues, and these tissues have nerves, and like the skin, when you put an ice cube in your on your skin, or when you sip a hot coffee on your skin, you will feel some pain. Okay, and that is the case for your teeth too. But if the pain was severe, that will lead to a condition called as reversible pulpitis. Anyways, the normal pulp histologically will look like this. We have seen it anatomically, which is the gross picture, and now we are seeing it histologically, which is the micro picture. And as we can see here, that that red line on the left is the predentin, and after that there is a dentin, and before it there is the odontoblastis, which are the cells that secrete the dentin, and then there is the letter B, which indicates the area of the cell-free zone, and then after that we have the pulp tissue. And I think that the cell-free zone will separate the hard tissue part of the tooth from the soft tissue part of the tooth, which is the white thing that I have showed to you previously. And also we have C, which is the nervous tissues, because I have said before that the pulp is a connective tissue and a nervous tissues too. And this is microscopically, we can see here that these are the stem cells that will specialize and become the tooth forming cells, and we can see also the fibroblasts are the vast majority of these cells, because it is a connective tissue and the connective tissue needs fibroblasts. And this is the normal pulp clinically. In a clinic we can see the pulp as this red thing, bloody thing that stops, the bleeding that stops, because if the bleeding does not stop, that will indicate to a disease process in the pulp. And this is the normal pulp radiographically, or not radiographically, because the pulp is a soft tissue, and soft tissues cannot be seen by the radiograph, but we use the radiographs to see the consequences of the pulpal diseases. Because if there is a pulp disease, there will be some leakage of this disease to the periapical or periradicular tissues, and these periapical or periradicular tissues will lead to bone resorption or destruction in that area, which will manifest as a radiolucency around that root, so that we do not see the pulp radiographically, but we can see its consequences radiographically. And this is the final picture of our normal pulps, as we can see here by a CT scan for it. We can see how beautiful it is, and we can also see the multiple accessory canals and ramifications that are present in every single root canal, guys. And I think this is the cause behind the failures of the endodontic procedures, because we do not use multiple and a huge amount of irrigation, and that is the thing that is, I think, and I consider the key to the successful endodontic